Welcome back to the deep dive. This is where we take the knowledge that, protects your license and really turn it into professional mastery.
Exactly.
And today we are doing a really critical deep dive into the absolute backbone of your study material. I'm talking about Chapter 4.
Oh, yeah. The big one.
The big one. The science of nail structure, disorders, and diseases.
And this is a deep dive that's really tailored for you, the person who's studying right now, the aspiring nail technician. Our whole mission today is to transform what can feel like, well, let's be honest, kind of dry biology.
It can be a little intimidating.
It can, but we want to turn it into your most powerful professional tool. I'm talking about the ability to look at a client's hands, assess their health, ensure their safety,
And operate within the law.
and operate strictly within the legal bounds of your practice. That's what delivers a truly expert, knowledgeable service that really sets you apart from everybody else.
This is really where we lay the foundation then. For a successful long-term career, we're moving beyond just, applying color. We are learning the architecture of the canvas itself.
Right.
Because if you understand the structure, you can do better grooming, better strengthening. You can customize any treatment for any client.
That's it. So when we talk about the natural nail, what are we actually looking at? We're looking at that hard protective plate.
Right.
And technically, it's an appendage of the skin.
Okay, so what does that mean exactly? An appendage of the skin.
It means it's part of the larger, the integumentary system. It's all connected.
Oh, okay.
And knowing that connection to the skin is vital. So many common nail issues are actually, symptoms of bigger skin or health problems going on system-wide.
So for your exam and just for your core professional identity, you have to nail down the terminology right away.
You really do. So let's start with the big one. The technical name for the natural nail is the onyx.
Onyx, like the stone.
Exactly like the stone. It's spelled O-N-Y-X, and it's pronounced A-H-N-X.
A-H-N-X. Got it. So what makes up the onyx? What's the material?
It's composed primarily of keratin.
Which we've heard of. That's the fiber-shaped protein in hair and skin, too.
Correct. But, and this is a key distinction the source material makes, the keratin in the nail plate is significantly more durable.
More durable than the keratin in skin.
Much more durable. And that durability is directly related to the protein's density, how tightly packed those cells are.
Right.
It's a shield. It's not just a pretty feature.
And that density must affect everything we do, from product adhesion to...
Everything. How fast it absorbs water, how easily it can be damaged by, say, aggressive filing or harsh chemicals. It all comes back to that keratin structure.
So let's get right into the why, the professional rationale. Why master all this biology when, a client might just care about the final color?
Right. Just make them look pretty.
Exactly. So we call this the 3 core duties. This is your professional safety net, and it's honestly the legal reason you spend so much time studying this chapter.
It is. So duty number 1. You have to be able to confidently identify conditions that are symptomatic of an infection or some kind of acute injury.
Things that should not be touched in the salon.
Should not be treated in the salon under any circumstances. This protects the client from harm, first and foremost, and it stops the condition from getting worse.
Okay, duty number 2.
You're the guardian of sanitation. Full stop. Your knowledge protects not just the client in your chair,
But every other client after them.
and yourself from the spread of disease. And that all comes down to diligent, consistent cleaning and disinfection.
And the 3rd duty.
And duty number 3, and this one is, it's kind of profound. Recognizing specific nail conditions, even the ones that seem benign, means you might be the first person to spout a visual cue.
A little red flag.
A red flag that signals a mild or even a serious underlying health problem. And that means you can make an immediate, non-diagnostic referral to a physician. You could literally help someone get the care they need.
It really frames the whole learning process differently. We found this quote from Marie Curie that just fits perfectly. Nothing in life is to be feared, it is only to be understood.
I love that.
This anatomical knowledge, it replaces that fear of seeing something you don't recognize with professional competence. It makes you the expert that the client can actually trust.
And that is the true definition of a professional advantage.
Okay, let's unpack this then. Let's dive into the microanatomy. The natural nail unit is, well, it's complex. It's not just the nail. It spans from the visible plate all the way back to the first knuckle.
All the way back.
So we need to define its 8 major components. Not just list them for an exam, but really understand what each part does for precise technical work.
Yes. The natural nail unit comprises the nail bed, The matrix, the nail plate, the cuticle, the eponychium, the hyponychium,
Specialized ligament.
and the nail folds, exactly. And when you're doing your work, shaping, filing, any detail work near the base of the nail, you are interacting with several of these distinct structures all at the same time.
Before we break those down, let's define the goal. What are the characteristics of a normal, healthy nail plate? What are we aiming for?
Visually, it should be firm, but it should also have some flexibility. The surface needs to be shiny, smooth, and generally unspotted.
And the color.
The color is usually a translucent white, which allows that rich blood supply from the nail bed underneath to show through, giving it that signature pinkish or beige look.
Now, here's one of my favorite details from the material because it totally changes how we think about nail health. Let's talk about water content.
Oh, this is huge.
We think of the nail as this bone-hard, dry thing, right?
But a healthy nail plate contains a significant amount of water. We're talking somewhere between 15 and 25% water content.
15 to 25%.
It's a foundational insight that directly impacts how well your surfaces last. If that water content drops below 15%, the nail becomes way too rigid. It gets brittle.
So that's when you see splitting and breakage.
That's a huge cause of it. And on the flip side, if the nail absorbs too much water, say it gets above 25 or 30%, which happens after, a long bath or doing dishes, it becomes overly soft and flexible, which can seriously weaken how well products adhere to it.
So this is why products like oil-based conditioners or certain polishes are so effective. It's not just cosmetic.
Precisely. The source material really emphasizes this. Using those oil-based conditioning treatments helps regulate that water balance. It coats the plate.
It creates a barrier.
A barrier, exactly. It prevents too much water from escaping, which causes brittleness, and it prevents too much water from getting in during hand washing, which can cause lifting. It's all about maintaining that structural flexibility.
Let's get into the components then. Let's start with the main event, the structure we actually work on. The nail plate, Nail-plate.
The nail plate is the most visible, most functional part of the unit. It's that hardened keratin structure, and it is formed entirely by the cells that are produced in the matrix.
And it just slides forward over the nail bed.
It does. And crucially, it's not one solid piece. It's composed of approximately 50 layers, sometimes less, of these keratin cells that are just tightly compressed.
50 layers. That explains why aggressive filing on the top surface is so damaging. You're literally stripping away those protective layers.
You're removing the armor, and of course that part of the plate that extends past the fingertip, that's the free edge.
Right.
And here's a critical professional terminology reminder, especially with the practical part of your exam. We apply polish to the nail plate, not the nail bed.
A common mistake.
It is, but using that precise terminology, it just elevates your work and minimizes any confusion with the client.
Okay, so directly underneath that plate is the nail bed, Nailbed.
This is living skin. It's what firmly supports the plate as it grows. And you mentioned the color. It is packed with blood vessels and nerves, which makes it incredibly sensitive.
How does the plate actually stick to the bed?
That connection is made by a very thin layer of tissue called the bed epithelium. That's B-E-D-E-P-I-E-T-lium.
Bed epithelium.
Think of it like microscopic Velcro. It creates this sticky surface that attaches the nail plate to the bed, and it also helps guide the plate smoothly along its path as it grows out toward the free edge.
So if that gets damaged...
If the bed epithelium gets damaged, the plate can start to detach. That's a condition we'll actually cover a little later on.
And the engine, the factory that creates this whole thing, that's the matrix, M-A-Y-trix.
The matrix is the absolute lifeline of the nail. It's tucked away right under the proximal nail fold, and it's the factory floor where all the nail plate cells are actually formed.
So everything starts there.
Everything. The matrix contains all the essential nerves, lymph, blood vessels. The health of the entire nail plate is decided right there. If the matrix is well nourished, if it's protected from injury, if it's free from infection,
It'll produce a healthy nail.
it will consistently produce healthy, durable nail cells.
Yeah.
But any injury to the matrix, even a small one, will result in deformities you can see in the nail plate as it grows out. Sometimes temporary, sometimes permanent.
What about that little white half-moon shape at the base? The lunula.
The lunula is simply the visible part of the matrix.
Oh, so it's not a separate part.
Not at all. It just looks whitish because of how light reflects off that underlying matrix tissue, which is a little thicker and not as translucent as the rest of the nail bed. It's important to remember, too, that the size and visibility of the lunula, they vary a lot from person to person. Sometimes it's completely hidden under the skin fold.
And what holds it all in place? We've got the specialized ligaments and the nail folds.
The specialized ligaments are incredibly tough. They are these fibrous tissues that anchor the nail bed and the matrix bed directly to the bone of the finger.
So they provide stability.
That's their whole job. They
Yeah.
provide the stability for the entire unit. And then the nail folds are just what they sound like, the folds of normal skin that surround the plate. They form that little trough, the nail groove. The fold on the side is what we often call the lateral nail fold or the sidewall.
Okay, let's shift gears to a topic that it gets really challenging in the salon. This distinction we're about to make is absolutely mandatory for your licensing exam and, more importantly, for client safety.
Yes.
We have to be able to precisely differentiate the non-living cuticle from the living skin that surrounds it.
This is truly where the professional separates themselves from the amateur. I mean, clients use these terms all the time, interchangeably. But treating the cuticle and the eponychium or the proximal nail fold the same way, that is a direct path to causing injury and infection.
Okay, so let's define the three main players here. Let's start with the biggest area, the proximal nail fold, or PNF.
The PNF is the entire flap of skin that sits over and protects the nail matrix.
Yeah.
The very top part is just normal skin. But the area that directly meets the nail plate, that part is keratinized, and it forms this strong protective barrier.
And that's what stops germs from getting to the matrix.
That's its purpose. It stops microbes, water, debris from getting to that incredibly sensitive cell-producing matrix underneath.
Now, for the part that we can remove, the non-living cuticle, KYOTicle.
The cuticle is non-living, colorless tissue. It actually originates from the underside of the eponychium. And as the nail plate grows forward, this cuticle tissue detaches and then it adheres really strongly to the surface of the nail plate.
And its function is critical.
It's absolutely critical. The cuticle forms a seal. It's a waterproof barrier. It prevents all those infectious organisms and debris from traveling down the nail plate and getting access to the matrix or even potentially the bone underneath.
So let's create an ID checklist for the practical exam. How do we know for sure it's the cuticle?
Okay, number 1, is it non-living? 2, is it colorless? 3, is it adhering directly to the nail plate? And 4, can it be removed with just gentle scraping after it's been properly softened?
If the answer is yes to all of those, it's cuticle.
It's cuticle and it's safe to remove. But if you encounter any resistance or if the tissue is clearly living and connected to a blood supply, you have to stop immediately.
Now let's contrast that with the eponychium. Eponychium.
The eponychium is defined as living skin. That's the most important thing to remember. It is located directly underneath that proximal nail fold, and it covers the matrix area where the new cells are being made.
Oh, we have some fascinating research on this.
We do. Doug Schoon's work back in 2019 highlighted just how incredibly delicate this tissue is. We're talking 0.1 to 0.15 millimeters thick.
That is microscopic.
It's basically one single layer of vital stem cells. So you can see why cutting it is so incredibly dangerous.
So the ID checklist for the eponychium or PNF is if it covers the nail matrix and if cutting it would cause bleeding, even a tiny bit.
Then you are dealing with living tissue. You're dealing with the PNF or the eponychium, and you are actively injuring the body's primary defense mechanism.
Which brings us right to the scope of practice mandate. This is non-negotiable. This is legal territory. This protects your client, and it protects your license.
Nail technicians are explicitly prohibited from cutting, clipping, or trimming any living tissue. Full stop.
Any living tissue.
That includes the eponychium, which is living skin. We can gently push back the PNF to expose that non-living cuticle for removal. That's part of the service. But cutting living skin is entirely outside the scope of your license under any circumstances.
Even if the client asks for it.
It doesn't matter. A client's desire or their insistence does not override state law. It's a hard boundary.
A hard boundary every professional has to maintain. Okay, let's talk about the other end of the nail plate. The area under the free edge.
That's the hyponychium. Hyponychium. It's a slightly thickened layer of skin that forms the physical barrier between the fingertip and the free edge of the nail plate.
So it's another seal.
It's the seal at the other end. Just like the cuticle at the base, the hyponychium forms a crucial protective barrier against invading microorganisms.
What's the professional caution here then?
Treat it gently, really gently. Aggressive cleaning or scraping underneath the free edge can easily damage that seal, and that can cause the nail plate to separate from the nail bed.
Which is a condition called onycolysis.
Exactly. And once that happens, you've opened a doorway for infection. Our job is to be guardians of the body's natural barriers, not to break them down.
We have to talk about product labeling because this is a huge point of confusion. You walk into any beauty supply store and you see dozens of products labeled cuticle moisturizers or cuticle softeners.
It's pure consumer marketing. Think about it. The cuticle itself is non-living tissue. You can't moisturize or soften dead material.
Right.
The products that are labeled that way, they're actually designed to condition the living skin next to it. The PNF, the lateral sidewalls, the eponychium, keeping those areas supple and healthy is the goal.
Whereas a cuticle remover is a completely different thing.
A completely different category.
Yes.
Those are specialized professional products. They contain strong chemical agents, often high pH ingredients, and they're designed to quickly... Exactly. And, using the proper technical terms in the salon, even if you preface it by saying, okay, now we're going to apply the conditioning oil to your PNF, it just demonstrates that professional precision.
Speaking of precision, let's transition into how this whole unit works over time. How does this plate actually grow, and what influences its appearance in the long run?
Well, the growth of the nail plate is fundamentally influenced by systemic factors. So nutrition, consistent exercise, a person's overall general health.
The big picture stuff.
The big picture stuff. But structurally, the size, the length, the shape of the matrix that determines the entire architecture of the nail plate that results from it.
So wait, the length, width, and curvature of the matrix predetermine the plate's final thickness, width, and arch.
Absolutely. The rule of thumb is this. A longer matrix will produce a thicker nail plate.
Why is that?
Because it has more physical space and more time to create and compress the cells before they emerge onto the nail bed.
Which brings us to a critical professional disclaimer.
A huge one. Nothing you apply topically and no dietary supplement you can take can make the nail plate grow thicker.
That's a big myth.
A huge myth. That outcome is determined entirely by the natural physiological size of your matrix.
Yeah.
All we can do is maintain the health of what the body is already producing.
Let's talk about the growth calendar. What are the average rates we should be telling clients?
The average adult rate is about 1/10 to 1/8 of an inch per month, or about 2.5 to 3 millimeters per month.
But it's not constant?
It's not a constant machine, no. We see growth accelerate during the summer months, probably due to better circulation, higher activity levels, and children's nails also grow much faster than those of the elderly.
I find the differences between the fingers so interesting.
Yes, the middle finger typically grows the fastest, and the thumbnail is often the slowest grower.
And hormones play a big role too.
A massive role. One of the most remarkable influences is hormonal change. Nail growth can accelerate dramatically during the last trimester of pregnancy. And this is solely due to those hormonal shifts. It's independent of whether the client is taking prenatal vitamins or not.
It's a powerful illustration of the matrix just responding to those systemic signals from the body.
Exactly.
Let's talk replacement timelines. If a client has a major trauma and loses a nail plate, how long until they see a completely new one?
This is a crucial metric for setting client expectations. For a fingernail, complete replacement of the plate typically takes about 4 to 6 months.
4 to 6 months.
But for toenails, the process is significantly slower, and the plates are also thicker. Complete replacement of a toenail takes anywhere from 9 months to a full year.
And that thickness difference is just because the toenail matrix is longer.
That's right. The toenail matrix is longer, which creates a thicker plate, even though the overall growth rate is slower.
As clients age, they often complain about vertical lines, which everyone calls ridges. How do we explain the anatomical reality of that?
This is a constant opportunity for you to educate and really impress your client with your knowledge. The matrix does not produce ridges.
So what are they?
What clients are actually experiencing is the development of narrow grooves running lengthwise down the plate.
Grooves, not ridges.
Grooves, not ridges. This happens as a normal part of aging because some parts of the matrix permanently slow down their cell production. This causes these slight indentations in the otherwise uniform flow of keratin cells.
So it's not an unhealthy growth, it's just an uneven slowing of the matrix factory.
Precisely. And this leads to a critical safety alert that every tech must follow. You must never file these lengthwise grooves in an attempt to make the nail plate smooth.
Why not?
Because doing so will thin and weaken the entire nail plate. You're filing down the thicker parts to match the thinnest parts, making the whole thing fragile and prone to splitting. You're defeating the entire purpose of the service.
So what's the professional solution?
A gentle buffing block and a good ridge-filling base coat, not aggressive filing.
This feels like the ultimate test of professionalism. We're moving now into identifying unhealthy conditions, and we have to remember our role. We are expert cosmetic technicians. We are not medical doctors.
Our job is identification and then immediate appropriate action. The action is either continue with the cosmetic service or provide an immediate medical referral.
The licensing limit is absolute.
It is. You are licensed for beauty and cosmetic services that enhance appearance. You cannot diagnose a disease, you cannot treat an infection, and you cannot prescribe medication.
So if a client asks, do you think this is a fungus? Your answer has to
I
be.
can't diagnose that, but based on my professional training, this condition needs a physician's evaluation before I can safely perform any services on it.
And that leads directly to the mandatory refusal of service rule.
You must refuse service if a client comes in with a nail or skin condition that shows any signs of infection, inflammation, broken skin, or swelling. Any of those four.
And this includes ingrown toenails.
Especially ingrown toenails. If you see redness, pain, pus, or acute swelling, your hands come off the client immediately and you provide a referral.
Let's start with the first category, common nail disorders. These are conditions usually caused by injury or heredity, and they're generally not infectious.
Right, and in many cases, if the skin around them is intact, we can cosmetically improve or camouflage them.
Let's start with a simple injury. The bruised nail bed. BROOZDNAYL bed.
This is just a hematoma. It's a dark, purplish spot from an injury to the nail bed that causes a blood clot to get trapped under the nail plate. It's harmless as long as the plate itself isn't broken.
And the professional response.
You can usually cover it very easily with an opaque polish or an enhancement product. It'll just grow out with the nail plate over time.
Okay, the painful, annoying hangnail. HANG nail.
This is just split or torn skin around the nail plate. It
Yeah.
often happens near the eponychium, usually because of dryness.
Can we trim it?
You can use sharp, sterilized nippers to carefully trim only the detached, dead skin tags of a hangnail. But you have to be absolutely cautious that you do not cut into or tear any living skin. If it's bleeding or inflamed, it's a mandatory referral.
Onychophagy. Onychophag, or, bitten nails.
This condition results in severely shortened plates, often a damaged PNF, calluses on the skin around it. This is a habit, not a disease.
So we can help.
We can definitely help. Frequent, consistent, and positive reinforcement manicures, combined with professional care and conditioning oils, can often help clients grow out the damage and overcome the habit.
And the classic white spots. Leukonychia.
These are harmless whitish spots. They're caused by minor injuries to the nail matrix, often so small the client doesn't even remember it happened.
And they aren't a sign of disease.
No, not at all. They're just uncompressed cells that got incorporated into the nail plate. They will simply disappear as the nail grows out. You can continue service as normal.
Now we move to disorders that require a bit more careful management, or maybe even a referral. These can be indicators of systemic issues. First up, Bowes lines. BOZLYNZ.
Bowes lines are visible depressions, like little indentations running across the entire width of the nail plate. They signal that the matrix temporarily slowed down or even stopped cell production completely.
And what causes that?
It's usually the result of a significant systemic event, a serious illness, a very high fever, major surgery, some kind of severe trauma to the body.
So it's almost like a timeline marker of when that illness happened.
That's exactly what it is. When you see Bowes lines, you know that your client experienced a major health event 3 or 4 months ago, depending on how far the line has grown out. The nail itself isn't infected, but service should proceed very gently.
Next, eggshell nail. EGG shell NAYLZ.
These nails are noticeably thin, they're white, and they are excessively flexible, just like an eggshell. The causes can be improper diet, heredity, or an internal disease.
But it can also be our fault.
Critically, yes, it can be iatrogenic, which means caused by the technician. Overfiling the natural nail plate with aggressive abrasives or an E-file can severely thin the nail, leading to this fragile state. We have to check our own technique when we see this.
Melanonychia. This involves pigmentation.
This is a significant darkening of the nail plate. It often shows up as a black band that extends from the base to the free edge. Now, this is quite common and usually benign in people of African American or Asian descent.
But not in Caucasians.
In Caucasians, or if the band appears suddenly and it involved the skin around the nail, it can be a potential indicator of a very serious disease, including melanoma. That requires an immediate medical referral.
Nail psoriasis.
This is a non-infectious chronic inflammatory condition. It's related to skin psoriasis. Visually, it can show up as pitting on the surface, severe roughness, discoloration, and often causes onycholysis. That's separation of the nail plate from the bed.
Can we work on it?
You can perform a gentle service, but only if there are absolutely no signs of a secondary infection or any broken skin.
Let's discuss onychorexis. Onychorecrasis.
This just means split or brittle nails. It's usually accompanied by those noticeable lengthwise ridges or grooves we talked about. Common causes are aggressive filing, heredity, or prolonged exposure to harsh chemicals like detergents or some cuticle removers.
And the professional response?
Gentle handling. Avoid metal implements. And recommend consistent conditioning treatments to restore moisture and oils.
Then we have nail pterygium. N-A-L-L-pterige. This sounds like a structural deformity.
It is a very serious one. This is an abnormal stretching of the eponychium or the hyponychium around the nail plate. It's almost always the result of a severe localized injury like a burn or specific allergic reactions that cause scar tissue to form.
And the rule here is?
The mandate is absolute. You must never attempt to treat, push back, or manipulate nail pterygium with any instrument. Conditioning oils are the only thing you can apply. Medical oversight is highly recommended.
Finally, the very dramatic pincer nail, pincer N-A-Y-L, also called a trumpet nail.
This involves a dramatic, often painful increase in the curvature of the free edge. The plate literally curls inward, sometimes forming a complete circle and pressing into the tissue underneath.
And what's our role?
Extreme or painful cases require immediate referral to a podiatrist. They may need surgical correction.
And this brings up a key point about that medical barrier clause. We see products online advertised to correct these nails.
That's right, and the source materials is explicit on this. Using any kind of brace product or device to forcibly straighten or correct a pincer nail is considered medical practice. It is prohibited for a licensed nail technician. Our role is to beautify, not perform corrective medical procedures.
We are moving now to the diseases. The absolute non-negotiable red flags. These mandate immediate refusal of service and a medical referral.
Because they all involve signs of acute infection or inflammation.
Redness, pain, swelling, pus, or broken skin. If you see any of that, you stop.
You stop. You should never, under any circumstances, provide any type of nail service to a client with a nail infection or disease.
Let's start with onycholysis. Onychalysis.
This is the spontaneous separation of the nail plate from the nail bed. It usually starts at the free edge and progresses back toward the linula.
What causes it?
It can be caused by injury, internal disease, really aggressive filing, or allergic reactions to products, especially some nail hardeners or artificial enhancements.
And why is this an immediate referral?
Because once that plate separates, the protective seal is gone. The exposed nail bed is now highly susceptible to secondary bacterial or fungal infections. We need a physician to find the underlying cause before we can ever consider service again.
Onychocryptosis. Onychocryptioaceous. The ingrown nail.
This is where the edge of the nail plate grows down into the tissue, creating inflammation and often breaking the skin. Because this condition involves potential infection, pain, and swelling, it is a mandatory referral to a physician or podiatrist.
We cannot touch it.
We are not licensed to treat, remove, dig out, or cut away ingrown nails. Even if the client says, oh, just get that little corner for me, the risk of creating a severe, deep infection is just too high.
Onychomodasis. Onychomodiosis. This is the separation and falling off of the nail plate.
Yes, the whole plate separates from the bed. This is usually the result of a severe localized trauma to the matrix, a really serious systemic illness, or some medical treatments like chemotherapy. Given the severity of the cause, it requires immediate medical oversight.
And the big one, onychomycosis, onychomoaceous, fungal infection.
We have to be able to recognize the three common ways it presents.
Okay.
Onychomycosis is highly contagious. First, it can appear as whitish patches on the surface that can sometimes be scraped off. Second, it can look like long, yellowish streaks that are actually inside the nail plate.
And the third most common form.
The infection starts in the free edge and causes the nail plate to crumble and thicken as it invades the nail bed tissue underneath. This is highly contagious and demands an immediate medical referral and service refusal.
Then there's paronychia. Onychium.
This is a bacterial inflammation of the tissues surrounding the nail plate, the folds and sidewalls. It presents with all the classic signs: pus, swelling, acute redness, and localized pain.
And what causes it?
It often develops when the skin barrier is compromised. Think of people whose hands are in water and detergents all day. The skin gets dry, gets tiny cracks, and bacteria gets in. Mandatory referral,
Pyogenic granuloma.
This is a severe acute inflammation that actually leads to the growth of a red vascular lump of tissue. It starts in the nail bed and grows up to the plate. It's visually alarming, often tender, and needs immediate medical attention.
And the common term for athlete's foot, tinea pedis. T-E-N-E-A-P-E-E-I.
This is a contagious fungal infection of the feet. It shows up as scaling, peeling, red patches, usually on the soles or between the toes. This is extremely relevant to us because it can be so easily spread through contaminated floors, towels, or,
Dirty tools.
most critically, dirty tools and equipment used in a pedicure. If you see it, service must be refused.
And finally, a major caution point in our industry because we see it associated with product lifting. The bacteria Pseudomonas aeruginosa, Pseudomonas as aeruginosa.
Pseudomonas is a rapidly growing, highly contagious bacteria that is literally everywhere in the environment. It's frequently seen as a secondary infection when water, oxygen, and debris get trapped between the natural nail plate and an enhancement product that is lifted.
What are the visual signs we need to look for?
It starts in the early stages as just a small, kind of nondescript yellow-green spot. But as the bacteria multiplies and releases waste products, the color progresses really dramatically and quickly.
To what?
It goes from yellow to a deeper green, then brown, and finally a dark black color in the advanced stages. If you see this, the enhancement has to be gently removed, the plate exposed, and the client must be referred to a physician.
So all of this brings us directly to sanitation. Since we deal with contagious diseases and the constant risk of cross-contamination, sanitation is your absolute defense and your professional responsibility.
The professional insight here is that proper cleaning and disinfection reduces the risk of spreading these infections, not just from client to client, but from the tools back to you. If you ever see recurring infections in your salon, it demands an immediate, meticulous review of your sanitation procedures.
There are no shortcuts. We have to follow the actionable steps precisely every single time.
This means using only EPA-registered disinfectants approved for salons. It means mixing them correctly according to the label's dilution ratio. And crucially, that solution must be changed daily, or whenever it's visibly soiled, because its effectiveness degrades very rapidly.
And tool management.
All reusable metal implements have to be thoroughly cleaned, scrubbed free of all visible debris, and then fully submerged in the disinfectant solution for the required contact time on the label. And all single-use items like buffers, porous files, wooden pushers, they have to be thrown away immediately after use on one client.
This diligence, a clean towel for every service, cleaning the table before and after, proper hand washing. This is the barrier that prevents the spread of pathogens like tinea pedis or resistant bacteria from one person to the next.
It is the foundation of your professional liability protection.
Now let's talk about protecting yourself. Nail technicians are exposed daily to a cocktail of professional products, solvents, chemicals. Your integumentary system matters too.
Absolutely. Chemical safety is non-negotiable. Always follow the manufacturer's instructions and warnings right on the product label. If a warning explicitly says avoid skin contact, you must strictly avoid it.
Which usually means wearing personal protective equipment or PPE.
Yes, and the source material specifically recommends nitrile gloves.
Why nitrile?
Nitrile is the industry standard today because, compared to latex or rubber, it offers a high degree of chemical resistance while being significantly less likely to cause contact dermatitis or allergic reactions in either you or your client.
And if a technician is ever unsure about the safe handling or hazards of a product,
you must contact the manufacturer and get the safety data sheet, or SDS. This document has comprehensive information on the chemical composition, hazards, safe handling, disposal, everything you need to know. Knowing chemical safety is just as important as knowing anatomy.
If we connect all this back to the bigger picture, mastering anatomy and pathology is really about protecting your license and upholding the dignity of your profession as both an artist and a scientist.
Understanding the legal framework is paramount. In your state, the laws, which are the statutes set by the legislature, define the broad scope of your practice. And then the regulatory agencies create the specific rules you have to follow every day, like your sanitation protocols.
And nail technology is defined under cosmetology laws. That definition specifically lists what you are permitted to do.
Services that beautify and enhance appearance. If a procedure or a device is not listed in that law, you cannot legally perform it, period.
This is reinforced by the powerful medical barrier clause that's embedded in cosmetology law.
This clause dictates that no individual licensed under cosmetology, including nail technicians, can perform any act that is legally defined under another specialized license, like a medical doctor or a podiatrist.
So the bottom line, the ultimate reason for all this training is that intact, healthy skin is the only effective barrier to infection.
That's it. When that barrier is broken or cut or compromised, whether by an injury or an unsanitary tool, germs get in and cause infection. Every single thing you do has to minimize the risk of injury and maximize the protective integrity of the client's skin.
And to reiterate that final legal safety net, a client's insistence or a signed waiver cannot give you permission to work outside your legal scope of practice. You absolutely cannot work on diseased, infected, inflamed, or broken skin or nails.
Your license and your reputation depend on upholding that standard, and that ultimately elevates the respect for the entire profession. Professional dignity comes from having professional boundaries.
So we've covered the essential technical terminology, from the onyx and its keratin to the critical distinction between the non-living cuticle and the living eponychium. We've drilled down on nail growth, remembering it takes 4 to 6 months to replace a fingernail.
And most importantly, we have cemented the professional necessity of knowing the visual cues that tell you whether to reach for a tool or for the phone to make a medical referral.
We have provided the foundation for safety, compliance, and excellence.
We have.
And with that comprehensive knowledge, we want to leave you with one final provocative thought to mull over as you prepare for your professional practice. You now know that the nail plate is somewhat porous, that it contains 15 to 25% water. You also know that your profession exposes your hands daily to harsh solvents, soaps, and chemicals that actively strip away natural oils and moisture. So given this constant chemical assault on your hands, what detailed long-term personal protective measures beyond just wearing nitrile gloves during the service should you integrate into your daily personal routine to ensure your own integumentary system, your skin barrier, remains intact, healthy, and perfectly protected against the cumulative hazards of your trade? Think about that commitment to self-care as you continue your studies.
We'll see you next time for the next deep dive.